Beyond the politicians, beyond the candidates, these are your issues, and this is the Political Brief. Now, the recent Affordable Care Act premium increases have many Americans asking, is the president's signature legislation really working? To find out, our Political Brief team spoke with former president of the American Medical Association and a current senior associate dean at UB, Dr. Nancy Nielsen.
In reality, the Affordable Care Act is not failing. 20 million people have health insurance who did not have it before. It's the lowest number of uninsured in our country ever. And that's a good thing.
Despite that praise, Nielsen says the ACA does need work. The problem comes from the lack of younger, healthier patients in the health insurance pool that the system would need to cover the costs of the more expensive patients, who are either older and see the doctor more frequently or have pre-existing conditions. Nielsen says young people are opting out because the fine for being uninsured is a lot less than the cost of insurance. She says the ACA would need to carry heftier penalties and rely on bigger subsidies, something not everyone is on board with. But there are other ways of bringing down insurance costs. We broke down health insurance costs according to data from the CDC, and the biggest spender, hospital care. Almost 1/3 of all health insurance costs goes directly to hospital care. Another one, drug costs, 13% and climbing. That's things like prescription drugs, cough medicine, something you might buy at the pharmacy. Not only that, but medical experts say the biggest overhead costs for hospitals are the drugs that they have to buy. Michael Kropp is the president and CEO of Independent Health. He says that for insurance costs to really go down, drug prices need to be addressed.
It would take some significant action on the part of the government to either speed the production of competitive products coming through the approval process of the Food and Drug Administration, or, God forbid, taking a look at some sort of price controls that exist in just about every other country in the world except the United States. To really be able to address the cost of pharmaceuticals effectively.
Comparing hospital costs to this percentage here, more than 1/4 of all health insurance costs go towards professional services. Those are anybody like a primary care physician, dentist, eye doctor, really any other medical specialist. Now, according to the experts and the statistics, preventative care is a lot cheaper than a hospital visit. We spoke with Dr. Raul Vasquez, a local physician, and he says any new health care plan needs to promote preventative care.
Now they're nurturing more primary care. They want primary care to be bigger because it manages people, and people feel more attached to their primary care physician.
According to our local experts, steering patients toward preventative care and lowering drug costs is a step in the right direction. But each candidate has a different idea for how to make that happen. To see what your candidate has planned for the future of health insurance, check out our full story on the WKBW app or online at WKBW.com. For the entire Political Brief team, I'm Josh Bazan, 7 Eyewitness News.